courtesy, it's fine. It's just 5 o'clock, and I think for you all it's probably 7, so no problem at all. And I appreciate listening to the discussion and the questions. So, I don't know if I heard it right, but just trying to understand workflow and should the system go down? Is that what I was hearing? And what kind of connectivity or communication ensues after the?
Yeah, but it's basically, if there were a problem, what would be the end result? And I think we pretty much answered that question. But it came up as we were going online, so we thought it would be good to answer it right then. If it's okay with you, Michael, I'm going to go over here and just to give you an example, and I will tell you that the projector is not the best, but if I had a patient laying in bed just like this and the physician had a laptop, they can beam right into the patient's pupil. And with the help of a nurse, I can tell you it's much sharper on my screen than it is here. They can do pupil response with the help of the nurse. If they were doing an exam and doing the NIH stroke scale, which is the stroke scale that they typically go through to assess a stroke and the level of a stroke, they can very quickly assess the patient and determine what to do next. Is it somebody that you give TPA to, or is it somebody that you may keep in the hospital? What is the next training with the help of the physicians on the other side? They can do that type of thing. Oops, sorry, Michael. I've got Tracy's computer here, so I'm learning how to use it. So I apologize. And you can see that there's X-rays in the room, and I'm just going to give you a quick example. If the doctor didn't have access to the images, they can quickly, pull up to look at a film live, and you can see the resolution I can get, and that's just with the cameras we have in here. The cameras are extremely high resolution. I would venture to say they're probably the most expensive individual component in the unit. So that's, basically we wanted to show you what it was like to beam out to California. Who's that behind you, Michael? I saw someone doing something back there.
Michael Chan.
Hi, Michael.
And it's Jason behind you.
How are you, Pat?
I'm wonderful. And Michael.
Tracy's there too.
Yes, we are. Michael is one of our senior vice presidents, and I don't know what he's doing in the office. Usually he's overseas someplace, working on our international account, so I'm surprised that he's in the account. We're with Connally Medical Center down here just south of San Antonio, Michael.
Excellent.
So,
very nice.
now that we know you're here, we know who to. We'll just put since you're here, we'll just charge dinner to you.
There you go. Connally, south of San Antonio.
Yeah.
In Floresville,
Texas.
Is the health center there associated with a certain health system?
They're just no.
I was just curious.
Yeah. So basically, I'm going to let you all ask questions of these guys, of the folks out in California, if you'd like. Does anybody have any questions?
Yeah, I don't know if y'all have any questions for them, or if you would like for them to beam in here on this unit.
And see what it looks like on this side.
I'd like to see that.
Yeah, what does it look like from the patients?
Okay. I think, Michael, what we'd like to do is switch over and have, I think one of you planned on beaming in to show the patient, to show the audience here, the board, what it looks like from the other side.
Yeah, that's great. I think you'll have the benefit, hopefully, when I do that, of what you're seeing from us right now, to where, really just talking long enough to where you feel comfortable with this interaction. And typically, really almost always, it's a minute or less, where someone on this side, which you'll soon be on the endpoint side, is having a regular, natural conversation with somebody separated by distance. And it could be, across the city, or it could be across the country. But this is the interaction. This is what our system is designed to do. Operate at real low bandwidth rates, provide a very good, high-quality audio-video session, so that we're really, separated by states in this case, but it's just communicating as if we were here in the same room. So I'll connect it with you all to the unit that you have there.
Okay, if you do that, and I'm just going to explain something here on the bottom. On the bottom, Michael just mentioned how little bandwidth we need. There's a couple of horizontal green bars down there, and we're using, right now, we're using about 600K download and just over 200K upload, so we're using very little bandwidth. right now, just what you get on a typical, probably a 4G card closer to the city. So I'm going to go ahead and beam out and let Michael beam in. And again, that's how easy it is for a doctor to get on. Any place you have the internet. My favorite place to do demos is from Panera Bread. I don't recommend Starbucks, and I certainly don't train doctors to do any sort of exam from those locations. But you can get on literally any place in the world. Last year, I was in Vegas 5 times and never lost a dime because I never left the house. I was in Baton Rouge, Louisiana, and beamed into Belfast, Ireland, and helped some folks out there. So any place you can get to the internet, you can pretty much get to things very effectively. You know, I always tell people I wish this were around a few years earlier when my family suffered strokes and we saw some of the complications.
What is the feedback you get from stroke patients? Do they get added, do you feel more comfortable knowing
They feel very comfortable in the sense that anybody feels better if they know they're getting a higher level of care. You know, if you know you have an ER physician that's not used to doing this, or hey, I can go to a vascular neurologist that this is what he's trained to do, people are excited. They love that. I mean, you know, we have clients all the time. When you're going, whether it's a cardiologist or anything, when you're able to see that, because if a patient or a family is being transferred from here, hey, they don't know where they're being transferred to. You can say it's Methodist or wherever you're being transferred to, they don't know that. But if a family member and stuff sees a physician on there, patient satisfaction goes way up.